Hi, my name's Kelly Rowe and I'm the MSc course leader for nursing here at Teesside University, and I'm joined today by two third-year students soon to qualify as registered nurses this coming January. So first of all, Gemma, would you like to introduce yourself?
Hi, yes, my name's Gemma Cross and I'm a third-year student studying child field.
Lovely. And Molly?
I'm Molly, I'm a third-year student studying adult nursing.
That's lovely, thank you. So first of all, I just really wanted to think a little bit more about yourselves and what you did prior to joining this MSc pre-registration nursing course. So Molly first, what did you do? What brought you here to Teesside to do this course?
So after doing my psychology degree, I actually moved to Spain and I was teaching in Spain. And then obviously COVID happened, so I moved back home. I ended up volunteering in the hospitals and I just found it really rewarding. So I got a job as a healthcare assistant, and then just from there I ended up applying for the course.
Oh, brilliant. So what, you moved abroad, and what were you teaching abroad then, or what sort of age range?
I was teaching English,
right.
And it was, I mean, any ages really. It was all the ages from like 5 to adults.
Oh, that's really interesting. So you would have been there had COVID not happened,
Yeah.
and then you've come back.
Blessing in disguise.
Yeah. So when you say you got experience in healthcare, whereabouts? Where did you work?
I got a job on A&E at James Cook.
Oh, right.
So I think I was there for 1 or 2 months before one of the sisters said you should apply for your nursing. So I did that. It all happened quite quickly, and then I was on the course in January. So
Brilliant. Right, I'm going to come back to you in a second about the nursing and when you applied. What about you, Gemma? Tell us a bit about your background.
My background's something completely different. I was in aviation as cabin crew for 14 years. Again, like Molly, COVID hit and decided to rethink my career, rethink sort of what sort of things I was interested in, and I was always passionate about the aviation medical side of things, so decided to explore that route a little bit more. And yes, I sort of looked into, having my little boy, looked into things like being a teaching assistant and things like that, but it all drew me back to the medical side of things and ended up looking into child nursing.
Brilliant. And what about your sort of healthcare experience that's associated with that?
So obviously within the aviation we do a lot of the medical side of things, we do a lot of the training with the medical side of things, but also I was a carer, or I'm still a carer for a disabled adult, so I've done a lot of experience with that and look after her on a regular basis.
Brilliant, thank you. And then Molly, you said was it one of the nurses you said said you should think about going into nursing?
yeah, it was one of the sisters on A&E that I was working with, and I think she sort of knew I didn't really know what I was going to do next, and she just suggested applying for nursing. And then obviously I came across the master's course, which I thought was better because obviously it's 2 years instead of 3, and I already had that psychology degree to get into it.
Yeah, did it take a bit of time to come across the master's course, or did you kind of find it straight away, or did you hear about it, or was it just a bit of Googling?
I just found it on the Teesside website when I was looking at course options, and then I think I might have emailed yourself and just asked about the course and what the requirements were, and just went from there.
Did you consider the BSc, or was it just a no-brainer?
I did consider the BSc, but I think the biggest thing for me was it's 2 years instead of 3, so I went for the MSc one.
Yeah, brilliant. And you already had your psychology,
Yeah.
Did you do psychology at Teesside?
Yeah, I did.
You did as well, so you were familiar with Teesside.
Yeah.
Concept, brilliant. And what about you, Gemma? Did you consider BSc, or
again,
how did you find the MSc?
Again, like Molly, just when I went to look to apply, both courses came up within the website, and I thought as long as I have the qualifications and meet the requirements, then absolutely I would try and do it in the 2 years if I could. But if I hadn't been successful, I definitely would have done the BSc. It was just to push for it to be able to be done in 2 years. It was amazing really to be able to get there.
And why because on the MSc course we obviously have four distinct fields of nursing. So we have adult nursing, we have mental health nursing, learning disabilities nursing, and child nursing. So why child nursing?
I think just having my little boy, being around children, it was just, to me I wouldn't have done anything else but children's. Yeah, it was just what I had a passion for, to be honest, just working with children and helping them in there.
And coming to the end of third year, no regrets?
Absolutely no regrets, no.
It was the right field.
Absolutely the right field for me.
What about you, Molly?
I think just when I started working on A&E and when I was volunteering as well, I had a lot of experience with adults, and I guess I just enjoyed looking after them more so. So yeah, I just went for adult nurse.
And for you again, any regrets? Would you do any of the field nurse?
No, yeah, I'm happy I stuck with adults.
Yeah, happy that you stuck with adults. Adults is for you. So this course is quite distinct and different from maybe other nursing courses, because even though you are doing the field of child nursing and the field of adult nursing, we actually teach us all together in the same classroom. So you're taught alongside child, LD, mental health and adult nurses. What's that like as an experience? I'll come to you first, Molly. It's hard when you haven't got a comparison to make, but what's, you know, is there any positives? Is there any negatives of that experience?
I think it's definitely a good thing. The first thing that comes to mind is more so, obviously everyone's doing different courses, so when you come together on them odd occasions, because you don't really get to see each other a lot in university, everyone's got different stories or like different experiences that they've had that we can share.
Mm-hmm. Great. What about you, Gemma?
Again, like Molly said, I think all of us have come from different backgrounds, been on the MSc as well. We learn a lot from each other. So actually, nursing as a general, you need to learn a bit from every field to be able to be experienced and knowledgeable within your field as well. So actually learning from Molly within the adults and Molly's background has been beneficial just within the child field as well.
So the other thing that I've said to both of you, as well as your student colleagues, from the start and even before the start of the course, that this course is very, very challenging. Was that correct? Was it as challenging as I thought? Was it more so? Was it not as challenging as you thought? What's your...
I think because I've got some friends that did the BSc course and they did warn me about how it is an intense course, but I think especially for us doing in the first year when we had to do the 2 pad documents in 1 year, but again it is worth it because it was a tough year and tough 2 years, but now that we're coming to the end, I think as long as you balance your priorities and you can make it work, yeah.
Yeah, go on then. What about you, Gemma? Was it as challenging as you
Definitely
thought?
intense, definitely challenging, but I also feel it's good to challenge yourself, it's good to push yourself, and if you can get through it, then I feel it sets you up for a good career, and you know how to manage your time and your leadership skills and prioritisation. So I think it all actually does end up making you a good or well-rounded nurse, being able to push yourself that little bit and practice harder.
Definitely. So sticking on the challenging conversation, what has been the most challenging bit? What's been the most intense bit?
I think for me it was like finding the balance between work and, well, I was working still as a healthcare assistant whilst doing the course, so some days I was doing like 5 shifts a week. But you just need to make sure you do balance and take time out for yourself, otherwise things do get on top of you, and also seek support from the university as well.
And how do you do that? How do you create that work-life balance? What do you do that sort of, you know, releases or eases your stress?
I mean, for me it would just be taking a day out to see your friends, family, or just a day away from like the laptop, just and just taking time to yourself.
Yeah. Now what about you, Gemma, because you've mentioned you've got a little one, haven't you? So how do you create that work-life balance?
Again, it's a lot of organisation, a lot of planning, preparation, but again, like Molly, just when you get the opportunity to, just spending time with him is my release and my way out of just having a day with him. But again, it's just making sure you know what you needs to be done when it needs to be done, and just having a plan to make sure that you can fulfil that, because you have to manage everything, and sometimes you are working alongside, you're doing your placement and completing the academic studies as well, so it's just a case of making sure that you've got your time set out how you should do, really.
So just sticking a little bit with the academic side of it first of all, so on the MSc course, again, one of the big differences is compared to the BSc course is you come in and you have to submit all assessments at level 7. It doesn't, where the BSc course rises from level 4 to level 5 to level 6. We are good to go at level 7 straight away, which can be, again, challenging. But what I was interested in is we do a variety of assessments. So we do everything from a talking head video, we do an exam, we do some case studies. What's been your best assessment? As in, what have you kind of enjoyed doing?
I'm trying to think.
It would have probably been better saying what's the worst assessment, but we're going to be positive. What's the best assessment?
I think for me it was probably the case study one that we did. and that was just like reflected on your placement experience, choosing a patients and then just talking through your assessments and the decisions you made, because it sort of reflected practice more for me.
Yeah. So that's I think what you're talking about is your year 3 skills assessment, isn't it? And the year 2 one was where you had to talk about your skills so far and how you progress your skills as well. So was that another one that was quite
they
good
were
to
quite
do?
similar.
Because, yeah, it was. What about you, Gemma?
I want to say the talking head for me, because it was one that I absolutely dreaded. It was something I'd not ever had experience doing, but actually doing it and putting it together was something that actually really pushed me to challenge myself. And actually I learned a lot from just doing the talking head as a different style, because it was a completely different academic style. You didn't have to write it, it was just free talking. So actually that was probably one of my ones where I think I maybe gained the most skills from just trying to do that one.
That's interesting. And then the all-encompassing systematic review, the kind of the dissertation module, the big one. Remind us, Molly, what was your subject? What did you do?
So I was doing it on investigating the barriers people with autism face accessing health services.
That's right, and that was excellent. And even though that took over your life completely, you ended up with a very, very good project, didn't you, in the end of it, which was really good, and got a very, very good mark for that. And Gemma, remind me about yours.
Mine was the barriers that newly qualified nurses face when speaking up for patient safety.
Yeah, and same again. You put your all into it and ended up with a very good mark at the end. And I think I'm probably right in saying you live that piece of work, don't you? You know, it completely overtakes you. But I think what's probably good about that final module and getting to write a systematic review, it's an area that you are actually interested in. It's an area that you choose yourself, that you are passionate about yourself. Was it hard to come up with your subject choice, or did you know what you were?
Yeah, I did go back and with certain ideas back and forth, but I think when I've eventually come to that one, I knew that I was interested in that. And for me, it was, if I'm going to be doing this for months, I want to actually have a topic that I'm going to be interested in researching about. And
it was very, very good. And same with you, Gemma, did you kind of know what you were going to do, or were you?
Again, I think quite a lot of the course is self-directed study, and I think through doing a bit of that myself, it was a topic that just came up time and time again, and it drew me into an interest within it. And I think it's probably just from a year and a bit of just having, like I say, doing my own research, my own study, that it came from that, really.
And I think the other thing that's exciting about that module is that really you do a poster that's associated with it, you think about service improvement, you can really advance that. And then now that the module's over and you've got your marks, you can even consider publishing that. Is that something that you've thought about at all?
Yeah, I have thought about it. I think it's just a case of finding the right journal and speaking to you about it as well.
Yeah, what about you, Gemma?
Again, absolutely, yeah. I mean, it would be amazing to have that as a thing on your CV, wouldn't it? So yeah, absolutely.
Published piece of work, that's brilliant. So I'm going to move away from the academic side of it, which we know is all intense, and go to the placement side of it. What sort of placements have you had over the 2 years, Molly? Where have you been?
Some of the ones I really enjoyed, I had a placement on an acute assessment ward, and then more recently I had a placement on cardio intensive care.
Right, and why did you enjoy them? What made you say those two?
So for the last one, the intensive care, I've always had an interest in cardiology, and then once I started on there, I mean, even down from it makes a difference with the staff when they're friendly, but then I had lots of opportunities to go to theatres. It was a completely new experience, managing the ventilators and all the medications. I just found it really interesting.
That's really great, and to get an opportunity to go to theatre is excellent, isn't it? And to see an operation. How long were you down in theatre for?
The full day. I was watching a graft, so yeah, the full day.
Full day. Very tiring experience, very hungry experience. But it's very, very interesting. And what about the first placement you said? Was that an acute assessment unit you said? And why did you enjoy that one?
That was actually my first placement, but I think for me it was really similar to A&E, because it was a lot of obviously assessing the patient and loads of interventions and following the doctor's notes. So I think because I had that experience in A&E and then coming onto that ward, I just found it more comfortable, and I felt like quite competent in my role.
Feel as if you knew what you were doing a little bit, and I think that's the value of the healthcare experience prior to coming on the course. So we've got, as you well know, we've got a number of students that have just had the absolute minimum of 500 hours healthcare experience prior to starting the course. We've got other students that have had years and years and years of healthcare experience, and I think it does make a difference to have that good rounded healthcare experience and you know, like you said, sort of be confident, and certainly we are looking for students that have already got excellent communication skills, that know how to work within teams, that can work on their own initiative. We're looking for people that have that experience already, because of course we don't teach communication skills, because we expect by the time you get to year 2 in your nursing that you know they're already well established. So that's really good. And you mentioned there about the staff you work with. Is there anyone sort of that you think that you've worked with that has been very good with you as a student? Have you had that support out in practice? What's that been like?
Yeah, I think, to be honest, I do think the majority of nurses you work with, like obviously everyone's had to come through the same thing, everyone's done their placement hours, so a lot of them are like very supportive and teacher, but I think especially with the understaffing at the minute you can have difficulties on the ward, but it's just a case of every day is not the same, so you might have one bad experience the next day, but then the shift the next day could be
completely different. I think I look back again to my nursing and the days that, and I've nursed for a number of years as a children's nurse, and the days that make the greatest impact, the greatest difference to me is when you can walk away and think, I did a good job there. Have you had them days? Have you experienced those days where you think, yeah, I've done well today, I've really made a difference, yeah. And I think that's it, and I think it's when you make a difference to your patients, at the end of the day, they're the good ones, they're the ones that you walk away happy, and even if you've had a difficult, struggling day, as long as you know that you've given your best, then you can walk away happy. What about you, Gemma? What placements have you had?
So I started with the general acute paediatric ward, and then I've had experience within paediatric critical care. I've followed the specialist nurses, so I've had like placements within diabetes, epilepsy, and then I've also had experience within paediatric A&E as well, and within neonates.
And within neonates as well. Being at neonates. So again, is there any of those placements that stand out to you? Any favourites along the way?
I feel that the general paediatric ward gave me my skill set, my basic skill set for then which I could develop, because you sort of had an all-rounded experience of different conditions and things that came in, which then set me up for other placements. But I really found I learned a lot and gained a lot of skills within the paediatric critical care unit, because obviously we had more intense conditions coming in, and it was more critical care. So I feel that that really did set me up for other placements and gave me the confidence to think I can do this. I've experienced this. I've had, you know, challenges with this. So that's actually set me up for actually working within the emergency department, because I feel like I've seen these things before, and just gave me the confidence to work a little bit more independently.
And I'm just thinking now, as you're talking and you mentioned neonates at the end there, if you think about your experience of nursing between the two of you, you really have done the lifespan, haven't you?
Absolutely.
You have done those tiny neonatal babies born before their due date, where, Molly, you're currently on a ward with predominantly elderly patients. Yeah. So you're really seeing the whole lifespan, the whole circle. And I remember, Gemma, before you went to neonates, you'd never had that sort of experience before, and that was, you know, what was that like working with those tiny babies, and again predominantly the parents?
Absolutely. And you know, it was quite scary to walk into, because you think these babies are in such a critical condition and you think they're just so tiny and delicate, but actually it's a privilege to be part of that experience with the family, going through those emotions that they feel and being there for them. And it's, you know, you're on their journey with them, and it's actually a privilege. And I actually spent quite a long time, I think it was 8 weeks in all, that I was on the neonates, and actually seeing these little babies grow, get better, go home. And you know, you had that journey, we had little journey logs that we had with the parents, and it was just sharing in their experiences and learning from them, and them learning from you. And it was actually, like I say, it was just nice to be part of that journey and seeing them get better and go home where they should be.
And one of, you know, our huge philosophy we have in children's nursing is about family-centred care. So within children's nursing, you're not just looking after the child, are you? So what sort of families and how much of the extended family have you seen during your time?
Oh, absolutely. And you see the grannies, the siblings, the mums, the dads, the aunties, the uncles, and they're all going through it. And obviously at the minute or previously with COVID, it was a limited amount of families members allowed in at one time. So it was, you know, each time somebody came in, you felt like you had to extend the care to them because they maybe hadn't been there with them, but actually putting yourself in their place as a mum and what they're going through. And yeah, it's just sort of making sure that they're kept informed of what's going on and that they're involved in the child's care as well.
So on the same sort of slant, Molly, in adult nursing we talk very much about patient-centred care, don't we? You know, and now patient being absolutely at the heart of it. But what's your experience with family and friends and visiting and people, extended family, being involved in your patients' care?
I mean, I think there is a lot of similarities, no matter what the age. A lot of families want to be involved in the care and obviously updated with what's going on, especially on wards like intensive care, where the patients, I mean, a lot of them are like intubated, sedated, so it's up to you to sort of update them on how they've been, or like little, I don't know, maybe some good news, like they've moved the hands today, just about keeping the families positive and updating them in what the plans are.
And on your sort of experience you've had, have you seen the full patient journey? Have you seen a full patient hospital from admission to discharge?
Yeah, I've seen a few. I think, well, on my acute assessment ward, it was a lot of patients were coming from A&E, admitted or through GPs, and then were admitted onto that ward, and it was a case of getting certain interventions done that they needed, and with the aim to go home, not to go on to another ward for a long-term stay. Yeah,
good. And then we've talked quite a bit about, you mentioned a little bit, Gemma, but we've talked quite a bit about sort of inpatient care and hospital-related placements. Have you had a community placement, and where's that been?
Yeah, I had a community placement with community matrons in Gisborough. So that was a lot of patients with illnesses like COPD and asthma, and just it was a lot of patient education and teaching them how to cope with their illness or certain medications they should be taking. So it was definitely a good insight into how people live outside of the hospital.
And was that kind of your 9-to-5 type placement, Monday to Friday?
Or? Yeah,
as opposed to your hospital placements, which do they tend to be 12-hour shifts or
Yeah,
thereabouts?
for me, yeah.
And have you done some night shifts?
Yeah, I've done a lot of night shifts.
How has that been?
To be honest, I don't mind night shifts. I quite like a mix of them. It doesn't bother me too much, but then I don't have kids, so
Do you manage to sleep then after your night shifts?
Sometimes, yeah.
Yeah, good. I always slept really well as a student after my night shifts. What about you, Gemma? You mentioned being with the specialist nurse. Is that the only community placement you've had?
Yes, so that was the only community placement, and quite a lot of that was within the hospital setting, but we did have the opportunity to go out to people's homes and just check their care there, and obviously for patients that couldn't come into the hospital, we went to just go make sure that they were managing their condition, and if they needed any medication tweaking or anything like that, just to make sure that they were safe.
Did you get out to schools at all then?
I managed to do within the epilepsy, I managed to go out to one school and work with one of the nurses to give, it was more so to give the teachers the education for a new student that was coming in with epilepsy and how to manage that.
I think it's listening to you both and knowing from my own background, and I worked before coming to Teesside University full time, I worked predominantly in the community, and you've both mentioned education, and education's actually a huge part of nursing. It really, really is that. We're often doing teaching on a one-to-one or a small group, or we can find ourselves teaching large amounts of people, whether they be service users or whether they be other members of staff, or like you said, in education. So I think that's an interesting part of nursing as well. So when you think about the future, Gemma, okay, what does the sort of short-term future hold for you?
For the moment, obviously, I want to get my skills set up and get the experience that I need within, and then obviously just do the natural progression and hopefully one day progress to being a sister, or even further if possible, just progression up the ladder.
And have you started, you know, you're due to qualify in January, have you started looking for jobs?
Yeah, so applications have all gone in for those, so it's just waiting for closing dates of the applications and see what comes of that. So.
And are you seeing yourself more in a community setting, or are you seeing yourself more in a hospital setting?
In a hospital setting, I feel is where I'd be predominantly set, I think, so yeah.
But in your long-term plan, you mentioned you're hoping to, after you've consolidated your training, after you've got that established skill set, you're hoping to advance your career.
That would be my goal.
That's your plan. What about you, Molly? What does the short-term future hold?
So we're going back to our hub placements, and which for me is the cardio intensive care, which I've actually got a job on. So straight after that placement, I'll be starting working there.
Excellent. How does that feel? Because you said right from the start, you said cardio was one of your interests. How does that feel to,
yeah,
you know, is this the dream? Is this the job you wanted?
Yeah, I am really happy with that, and I know the staff are really nice. I'm interested in the field, so I'm just looking forward to starting now.
That's brilliant. That's really good news. Congratulations. And what about the long-term future?
I think, like Gemma said, it's just going to be about sort of improving my skill set, and I think in the long term the idea of like a clinical practitioner sort of interests me, but that'd be very long term. Yeah.
In Cardiff or elsewhere?
Yeah, I think most likely.
So you feel as if you're
either there or maybe back to A&E. I'm not really sure.
Yeah, it's maybe like an advanced nurse practitioner or something like that on A&E. And I think that's the thing. I think that's kind of a nice way to end our conversations today. It really is like the world's your oyster in nursing. It's, you know, it's the, and there's, again, thinking back to my career, there's doors that open that you didn't even know that door existed. You don't know the jobs are out there sometimes, especially in those specialisms. And the world of nursing's advancing, and the amount of jobs like advanced nurse practitioner, you know, is really sort of gaining speed and really increasing. But I think you've got, within children's nursing, there's so many options. You've been to such a mix of placements already, and there's so many more out there that you haven't experienced. And again, in adult nursing, there's huge amounts of scope for doing what you want. And of course, as a nurse, as well, you mentioned earlier, Molly, you worked abroad. As a qualified nurse, if any of you choose to work abroad, you've already seen a bit of the world, Gemma, you know, your options are open. And we've got students who are about to qualify, who are thinking about going away, who are thinking about travelling, and you know, would have a very, very good chance of getting a job in another country. But long may your careers continue. I think you've got really good and really exciting futures ahead, and I really can't wait to see where you go and what direction you go in. But thank you so much for joining me today and giving people a bit of an insight about our pre-registration MSc Nursing course at Teesside. Okay. So if you'd like to find out more about our course and you'd like to study pre-registration MSc Nursing at Teesside University, neither children's nursing, mental health, learning disabilities or adults, then please contact us for further information or book a place on one of our open days.